This video demonstrates the Welch Allyn CVSM vital sign monitor for managing deterioration and integration to IMR. Before you commence taking vital signs, perform the following steps to ensure the device is set up and ready to go. Select the Review tab and delete any old or previously stored vital signs. Ensure the device has at least 2 bars of Wi-Fi signal. Ensure that the spot check is the mode selected. Clear the front screen. To enable Vitals integration, the patient must have a printed armband attached for the correct IMR encounter. Select the Clinician ID icon from the top left-hand corner of your Home tab on the monitor. Scan your Clinician ID Aztec code and press OK on the screen to validate it is you. Here's a tip. If you forget to press the Clinician ID icon before scanning your Clinician ID Aztec code, your details will populate into the Patient Details window. You will need to wait until the Patient Search spinning wheel times out before clearing the front screen and starting again. Confirm the patient's name on the wristband, scan the patient barcode, and confirm with the patient that their name matches the patient name displayed on the Welch Allyn device. Here's a tip. If the patient's name does not display on the Welch Allyn device after scanning, it's likely that the Wi-Fi is not connected and the vital signs will not send. Restart the device at this point and ensure there are at least 2 bars of Wi-Fi signal before commencing the vital signs integration. The patient's age will determine which early warning tool is automatically selected by the Welch Allyn device. To manually change the tool selected, for example to change a pregnant patient from a QADS to a QMute, select the EW box and then select the appropriate tool. To confirm, select Enter Scored Data. For today's demonstration, I will keep the QADS tool selected and then cancel to close the box. Begin by attaching the BP cuff and the SATS probe to the patient. Select Start on the screen. This will inflate the BP cuff. To take the patient's temperature, you can use the tympanic thermometer, attach your cover, and take the reading. Once the temperature has been taken, eject the cover and ensure to dock the thermometer nose first. The temperature reading will display on the screen. To take the temperature orally, remove the probe from the device and apply a cover. The Welch Allyn defaults to oral temperature. Once the temperature has been taken, eject the cover and redock the thermometer. The temperature reading will display on the screen. The Welch Allyn device will measure temperature, pulse, SpO2, and blood pressure systolic. Select the height and weight box on the front of the screen. This will open up the additional parameters box to manually enter any other required vital signs. For example, oxygen flow rate, a respiratory rate, AVPU. For pediatric patients, you must also manually enter respiratory distress and capillary refill to calculate an early warning score. Remove the BP cuff and SATS probe from the patient. To view the parameters completed, select the QADS, QMute, or QT fields on the front monitor. Once again, confirm the correct early warning tool is selected. Select Enter Scored Data. This will open the summary screen of the parameters entered and their individual EWS. These are vital signs that will be finalized and sent to the patient's IMR record. Here's a tip. Ensure all vital signs are complete and accurate at this point, and if required, correct any errors before moving to the next step. Select Save on the screen to send the data to the IMR patient electronic record. Save Successful and Send Successful messages will display along the top as a banner message if the vital signs have successfully sent to IMR. Here's a tip. If Send Not Successful displays in the banner bar, the vital signs will be saved on the Review tab of the Welch Allyn device. The vital signs will not be visible in IMR and will require manual entry into the patient's record. The Welch Allyn device will display all parameters entered, their individual EWS value, and the total early warning score calculation. Clinical decision support for all total early warning scores of 4 and above will display in the right window. Select OK to close the window. If any parameters are in the critical range, the wording will prompt you to make a MET call. The vital signs are now visible in the IMR patient record. To track the vitals trending for your patient, open the patient's Managing Deterioration screen or page. A yellow alert message indicates a home team call may be required, and a red alert indicates that a MET call may be required. Select Immediately to view the patient's trending. Here's a tip. If your patient has altered calling criteria documented in IMR, it's not for MET calls, or has an ARP, this information will not be known by the Welch Allyn device. IMR remains the source of truth and is the patient's medical record. Any required action or interventions should be confirmed by the chart review, discussion with the medical team, and clinical handover as per TUH procedures. Any additional documentation should be completed in IMR as soon as possible.